Some surgeries are called routine, covered by insurance without a second thought, yet they can permanently change your ability to live independently after 60. And the scariest part, nobody warns you until the damage is already done. Today, I am going to walk you through 5 procedures that I would never allow anyone in my family to undergo after age 60. Most people assume that if a doctor recommends surgery, if insurance pays for it, and if hundreds of thousands of others have gone through it, then it must be the right call. Modern technology, advanced techniques, minimal risk, that is what we are told in a brief office visit. But after years of studying what happens 6 months, 1 year, even 2 years after these operations, I can say with confidence that for many people over 60, the dangers quietly outweigh the benefits. And here is the part that should concern every one of us. The medical system defines a successful surgery by whether you survive the procedure and the first few weeks of recovery. What they rarely track is whether you can still climb your own stairs 6 months later, whether you can drive yourself to the store, or whether you can get through a day without chronic pain stealing your independence. I am going to break down each surgery, explain exactly why it poses hidden threats to your body after 60, and most importantly, share safer alternatives that most surgeons never present. And the number one surgery on this list is so widely performed that over 500,000 Americans go through it every single year. Stay until the end, because I will also give you a concrete action plan you can start using immediately. But before we get to the list, you need to understand something fundamental about your body after 60-something that changes the entire conversation around surgery. As you age, your body undergoes shifts that directly affect how it handles surgical trauma. Collagen production, the protein responsible for wound closure and tissue repair, declined significantly over the decades. By the time you reach your 60s, your body simply cannot rebuild itself the way it once did. Your immune system also weakens considerably, responding more slowly to infections and foreign invaders. Blood circulation slows down, which means oxygen and healing nutrients take longer to reach a surgical wound. Blood vessels become more fragile, and bone density drops by roughly 1% per year after 50. But there is one risk factor that rarely gets discussed before surgery, and it is called post-operative delirium. Research shows that between 15 and 53% of surgical patients over 65 experience this condition. It causes sudden confusion, disorientation, even panic, and it can persist for days or weeks. In some cases, it triggers long-term cognitive decline that never fully reverses. When you combine reduced healing capacity, immune system decline, anesthesia exposure, surgical trauma infection risk, and the possibility of delirium, you create a perfect storm of complications that no 5-minute consultation can adequately explain. This does not mean your body is failing you. It means you need to be smarter about evaluating when surgery is truly necessary and when a better option exists. And the first surgery on our list is a perfect example. Every year, hundreds of thousands of Americans have a perfectly functioning organ removed, and the majority of them never needed that operation in the first place. Surgery number 5, gallbladder removal for gallstones that are not causing any symptoms. More than 600,000 gallbladder removals are performed in the United States every year, making it one of the most common surgeries in the country. Here is the problem. A significant number of older adults are told they need their gallbladder taken out simply because an imaging scan revealed stones sitting inside it, even when those stones are causing absolutely zero pain, zero inflammation, and zero digestive problems. Your gallbladder is not a spare part. It serves a critical function. It stores and concentrates bile, the substance your body needs to break down dietary fats, and absorb essential fat-soluble vitamins, including A, D, E, and K. When you remove it, your body loses that concentrated delivery mechanism, and digestion is never quite the same. Gallstones become increasingly common as you get older, But here is what most people never hear. Only about 20% of people with silent gallstones ever develop symptoms. That means roughly 80% of people who have their gallbladder removed for stones that are not bothering them are giving up a functioning organ for no proven medical benefit. And the consequences can be serious. Research indicates that up to 40% of patients who undergo gallbladder removal develop chronic digestive issues afterward, including diarrhea, triggered by fatty meals, persistent bloating, and difficulty absorbing nutrients properly. For someone over 60, poor nutrient absorption is not a minor inconvenience. It can accelerate muscle loss, further decrease bone density, and even contribute to cognitive decline over time. If your gallstones are not causing pain and not causing inflammation, surgery is not the answer. The answer is protecting your body by maintaining a diet rich in fiber, limiting saturated fats, staying well hydrated, and working with your doctor to explore supportive approaches that keep those stones quiet. After 60, preserving every organ that is still doing its job should be the priority. Your body is a carefully balanced system, and removing one piece creates ripple effects that are difficult to undo. I am curious, have you or someone you care about ever been told you need surgery for a condition that was not actually causing problems? If so, type yes below, along with what kind of surgery was recommended. Your answers help me understand what our community is truly facing. Now, removing an organ you did not need to lose is alarming enough. But the next surgery on this list is a procedure that multiple major studies have proven is no more effective than doing nothing at all, yet hundreds of thousands of people still go through it every year. Surgery number 4, arthroscopic knee surgery for osteoarthritis. This is the operation where a surgeon makes small incisions in your knee, inserts a tiny camera and specialized instruments, and cleans out damaged cartilage while smoothing rough surfaces inside the joint. It sounds perfectly logical. Your knee hurts. The cartilage is worn down, so why not go in and tidy things up? Here is why that logic falls apart. Osteoarthritis is not caused by random fragments of cartilage floating around your knee. It is the progressive deterioration of the entire joint structure. Cleaning up debris inside a joint that is gradually breaking down does not address the underlying problem. It is like sweeping the floor of a house with a crumbling foundation. Multiple large-scale studies published in the New England Journal of Medicine have demonstrated this clearly. After 2 years of follow-up, patients who underwent arthroscopic surgery for knee osteoarthritis reported the exact same pain levels as patients who received physical therapy alone. The surgery provided no additional benefit whatsoever. Even more concerning, a significant percentage of patients actually reported that their knee felt worse after the procedure than before, likely because the surgery itself creates additional trauma, introduces scar tissue, and disrupts an already compromised joint. The alternative is both simpler and more effective. Targeted physical therapy designed to strengthen the muscles supporting your knee, combined with anti-inflammatory nutrition and supplements such as glucosamine and chondroitin, has been shown to meaningfully reduce pain for many patients. Your body after 60 has a remarkable ability to adapt and compensate when given the right support. Surgery interrupts that natural process, forcing your body into emergency repair mode when it should be gradually strengthening. Your knee does not need a scalpel. It needs the right kind of support, so your body can do what it already knows how to do. And you have far more control over that process than you might think. If a surgery that accomplishes nothing is worrisome, wait until you hear about the next one. This is a major operation that can turn a simple back pain problem into multiple new problems that are far more serious than the original complaint. Surgery number 3, spinal fusion for chronic lower back pain. This procedure involves permanently joining 2 or more vertebrae in your spine using metal rods, screws, and bone grafts. The concept sounds straightforward. If movement between certain vertebrae is causing pain, eliminate that movement, and the pain disappears. But the reality is far more complicated. Consider a woman in her late 60s, a retired teacher, who loved tending her garden. Before her spinal fusion, she dealt with chronic lower back pain that made gardening difficult and long car rides uncomfortable. Frustrating, certainly, but she was managing. Her surgeon promised she would feel like a new person within 3 months. What he never explained was what happens after vertebrae are permanently fused together. When you lock two vertebrae in place, all the stress that those joints use to absorb gets transferred to the vertebrae directly above and below the fusion site. Research consistently shows that a significant percentage of patients develop problems in these adjacent segments within a few years, problems that often require additional surgery. It is a cascade effect where one operation leads to the next. After her fusion, this woman could no longer bend down to tie her own shoes. She could not twist her body to check behind her while driving. She had to sell her 2-story home because navigating stairs had become unbearable. After months of intensive rehabilitation, she recovered roughly 60% of her previous mobility. But the fusion is permanent. That lost range of motion will never fully return. Here is what makes this especially frustrating. Studies comparing spinal fusion to intensive physical therapy for chronic lower back pain in older adults have found remarkably similar pain outcomes. The physical therapy groups maintained significantly better mobility, experienced no surgical complications, and saved considerable money in medical costs. This was not an unavoidable tragedy. It was a preventable one. Back pain limits your life, but spinal fusion can limit it even more. You deserve to know every option before consenting to a procedure that cannot be reversed. If you are still watching and finding value in this information, type the number 3 below. It lets me know this content matters to you, and every single comment motivates us to keep sharing important health knowledge like this. What I have shared so far is serious enough, but the next surgery genuinely concerns me on a deeper level. This is the one where they stop your heart, connect you to a machine, and for many older adults with stable chest pain, the entire ordeal may be completely unnecessary. Surgery number 2. Coronary artery bypass grafting for stable angina. This is open heart surgery in every sense of the phrase. Surgeons cut through your breastbone, spread open your rib cage, stop your heart from beating, and connect you to a heart-lung bypass machine that circulates your blood while they graft blood vessels harvested from other parts of your body to reroute blood flow around blocked coronary arteries. It is one of the most invasive procedures in modern medicine. For people experiencing a genuine cardiac emergency, bypass surgery saves lives. But for many older adults living with stable angina, meaning chest pain, that follows a predictable pattern and responds well to medication, the picture looks very different. Think about a man in his mid-70s, a retired engineer who had been managing mild chest discomfort with medication for 2 years. His cardiologist told him he needed bypass surgery before something catastrophic happened. Terrified, he scheduled the operation. Just days before the procedure, he sought a second opinion. His records told a reassuring story. His angina was stable. His heart pumping efficiency measured 52% well within the normal range of 50 to 70%. He was walking 2 miles every morning without difficulty. He canceled the surgery and committed to a comprehensive alternative approach instead. Targeted cholesterol management, an anti-inflammatory eating plan rich in omega-3 fatty acids and antioxidants, stress reduction techniques, and carefully supervised exercise rehabilitation. 6 months later, his angina episodes had decreased by 60%. His energy levels surpassed anything he had experienced in years. He later said he could not believe how close he came to having his chest opened when a better path existed all along. This is not one man's lucky break. This is what the research supports. The landmark COURAGE trial published in the New England Journal of Medicine followed more than 2,000 patients with stable coronary artery disease. It found that percutaneous coronary intervention, commonly known as stenting, provided zero survival benefit compared to optimal medical therapy alone. No difference in death rates. No difference in heart attack rates after 5 years. More recently, the ischemia trial published in the same journal in 2020 studied over 5,000 patients with stable coronary disease. This larger and more comprehensive study included patients who received both stenting and bypass surgery. The conclusion was the same. An early invasive strategy offered no advantage over conservative medical treatment for patients with stable symptoms. And there is another risk that rarely enters the conversation before surgery. Multiple studies have found that up to half of elderly patients experience some degree of temporary cognitive decline following open heart surgery, likely related to time spent on the heart-lung bypass machine. While many recover, some never fully regain their previous mental sharpness. You are not broken. Your body is managing your condition. Before agreeing to have your chest opened, you have every right to ask whether medication and lifestyle changes might serve you just as well, because the science says they very often do. If bypass surgery for stable chest pain is unnecessary for many, imagine what I am about to tell you regarding the most common surgery on this list. This is the procedure marketed as a miracle for hip pain, performed on over 500,000 Americans every year, and the vast majority of those patients may have had a better option they were never told about. Surgery number 1, total hip replacement for moderate arthritis pain. More than 450,000 Americans undergo hip replacement surgery annually, and the majority are over 60. It is presented as a transformative solution for hip pain, and the testimonials are undeniably persuasive. For a specific subset of patients with severe disability who have genuinely exhausted every conservative option, hip replacement can improve quality of life. But that is not who is getting most of these surgeries. Let me walk you through exactly what a total hip replacement involves. The surgeon saws off the ball at the top of your thigh bone. They hollow out your hip socket. They drive a metal stem deep into your femur. They attach a metal or ceramic ball to replace your natural one. They line your hip socket with plastic or ceramic material. When it is over, you have a completely artificial joint where your natural one used to be. And that artificial joint has a finite lifespan. Research confirms that modern hip replacements typically last 15 to 20 years. If you have the surgery at 65, you are looking at revision surgery around age 80 to 85. Revision surgery, where the old implant must be removed and a new one installed, is significantly more complex, carries considerably higher complication rates in patients over 80, and has lower success rates than the original procedure. The complications include infection, dislocation, fracture, blood clots, and in some cases death. But here is the part that troubles me most. The overwhelming majority of older adults who receive hip replacements are living with moderate arthritis pain. They are still walking. They are still functioning. They experience discomfort and some limitation in range of motion, yes, but they have not truly exhausted conservative treatment options. Picture a woman approaching 70, a retired nurse who spent her weekends hiking mountain trails. Hip arthritis was making her favorite paths more difficult. Her orthopedic surgeon pointed to her imaging results and said she needed a new hip as soon as possible. Conflicted, she sought another perspective. The question that changed everything was simple. Can you still do the things that matter most to you, even if they are harder than they used to be? She paused and answered honestly. Yes, it hurts more, but yes. Instead of surgery, she began a comprehensive conservative program. Glucosamine and chondroitin for cartilage support curcumin to address inflammation targeted hip strengthening exercises to stabilize the joint and low-impact activities like swimming and cycling to replace high-impact hiking. 3 months later, she returned in tears. She was back on the trails. Not as fast, not without some discomfort, but she was there moving through nature on her own natural hip. This was not magic. This was her body responding to consistent targeted support. Research confirms that supplementing with glucosamine, chondroitin, and collagen can meaningfully reduce pain in patients with moderate osteoarthritis. Studies also suggest that regular low-impact exercise combined with omega-3 supplementation may reduce arthritic pain significantly, with some research indicating effects comparable to anti-inflammatory medications, but without the gastrointestinal bleeding risks. There is something else that deserves your attention. A hip replacement permanently changes how your body moves. You cannot cross your legs. You cannot squat fully. You cannot pivot or twist aggressively. These restrictions apply for the rest of your life. This is not simply aging. This is accepting a permanent, irreversible intervention when reversible options have not been fully explored. Most orthopedic surgeons do not present conservative alternatives with the same enthusiasm they present surgery. The system is structured to reward procedures over patient management. That does not make them bad doctors, but it does mean the responsibility falls on you to ask the right questions and demand the full picture before making a decision you cannot take back. Your natural hip, even imperfect, allows a freedom of movement that no artificial joint can replicate. Before agreeing to replace it, give your body a genuine chance to show you what it can still do. Now that you understand the risks, here is exactly how to put this knowledge into action. If any doctor has recommended one of these 5 procedures, your first step is always seeking a second opinion from an independent physician, not someone in the same practice who may share the same perspective. Ideally, find a doctor trained in both conventional and integrative medicine who can evaluate your full range of options. When you sit down with that doctor, ask these critical questions. What happens if I choose to do nothing for 6 months? What conservative treatments have I not yet tried? What are the specific surgical risks for someone my age and health profile? And here is the most important question of all. Will this surgery extend my life, or is it only addressing symptoms that might respond to less invasive approaches? For daily joint and overall health support, talk to your doctor about whether supplementation with glucosamine, chondroitin, curcumin with black pepper for absorption, omega-3 fish oil, and collagen peptides might be appropriate for your situation. Incorporate 20 minutes of gentle daily movement, whether that is swimming, cycling, tai chi, or gentle yoga. Focus on anti-inflammatory nutrition as the foundation of your eating pattern. There are 3 critical mistakes you must avoid. First, never rush into surgery because a doctor uses fear to pressure you. If someone tells you that you need this right now, or you will end up in a wheelchair, that is your signal to walk out and get another opinion. Second, do not assume that pain automatically means you need an operation. Pain is your body communicating with you, not an automatic ticket to the operating room. Third, never skip conservative treatments and go straight to surgery. Surgery should always be the very last option on the table, not the first. Here is my challenge to you. Commit to giving conservative treatment a genuine 90-day trial before agreeing to any elective surgery. 90 days. Track your pain levels every single day. Notice the changes. Document your progress. Your body's capacity for recovery and adaptation will surprise you, and your independence will thank you for the patience. The power to change is in your hands right now. Age does not prevent you from getting stronger. It simply reminds you to be more strategic about how you do it. If you believe conservative treatment deserves a real chance before surgery, type yes in the comments. If you think surgery is always the best answer, type 0. Your response helps other viewers see they are not alone in questioning the conventional approach. As we have explored today, these 5 surgeries appear safe on the surface, but carry real hidden risks for anyone over 60, and in every single case, a conservative approach deserves a genuine trial first. Which surgery on this list surprised you the most, or have you personally experienced one of these procedures? Share your story in the comments below, because I read every single one. If this information could protect someone you care about, please share this video with them right now. Hit the like button so more people can discover this vital knowledge, and subscribe with notifications turned on so you never miss our upcoming health content. I believe that aging does not take away your body's ability to recover. It simply reminds you to care for it the right way, and sometimes the most powerful intervention is choosing not to intervene at all. We have prepared more videos on natural pain management and joint health that you need to watch, so check the description below. As always, discuss any changes with your doctor first. Thank you for watching, and here is to your health and independence.